Hey Tammy, sorry to interrupt the movie. You got through most of it. It was talking about some of our program and how we work with people through their addressing their health goals. Now I'd like to go over our exam findings with you. We looked at both structure and chemistry, mostly structure, and with the structure we're looking for misalignments in the spine that show up as either tipping or rotation. You have got a little bit of each. We're looking at the back of the upper half of your spine here, and what we see is a kind of a backwards S-shaped curve here, 8.2 degrees right at the top of your back, another 8.3 degrees right between the shoulder blades. Your left shoulder is higher than your right, and within that you've got some rotation that goes from right to left. So these misalignments are important because they impact a number of different parts of your body. They impact the soft tissues primarily by putting stress on the muscles, tendons, ligaments, and especially the nerves. And when you irritate nerves, nerves no longer work right, and they can cause all kinds of trouble for you. Anything from obvious things like stiffness, neck pain, headaches, back pain, to more subtle things because the nerves control everything your body does. So it can cause problems with your immune system, your digestion, your energy level, your balance, and so on. So we want to make sure these nerves are functioning as clearly and as properly as possible. So that's the upper half of the spine. If we look at the side view of your spine, we find that the normal curve in your neck should be like this, and yours is not only straightened, but actually backwards a little bit. See how that curves the opposite direction there from where we want it? That's called anterior head carriage, or kyphosis, or military neck. And so it's a little bit like this. Your head is in front of your shoulders. We want to get it back, because the farther forward it goes, the more it stretches the tissues in the back here, which include the muscles at the back of your neck, as well as the spinal cord itself, and it does not want to be stretched. Again, that irritates those nerves and keeps them from sending messages properly from your brain down to the rest of your body. We'll come back to this in a minute. Low back, the curve is also a little straighter than we'd like it. We want 130 degrees here. Yours is 120 degrees. So we want to get that curve back the way we want it. Looking at the back of your low back, again, we've got a combination of sideways curve, 11.7 degrees here, and 5.5 degrees right at the bottom of your spine. Your left hip is higher than your right by 12.3 millimeters. And again, a big misalignment there, rotational misalignment. So a lot of opportunity to irritate those nerves and keep them from functioning well. So my job is reducing misalignments by adjusting you and keeping these joints moving properly so that there's less irritation on the soft tissues, particularly the nerves. So we do that by adjusting you. So our job is realigning the spine. Your job is keeping it where it belongs. And that's a challenge for 3 reasons. Number 1, and I didn't go over this yet, but we tipped your head back and took a picture to put your neck under some stress to see if there's a whiplash injury in there, and there is. There's a little hypermobility here at C5, and when you tip your head forward, there's hypermobility at C4 and C7. So those vertebrae are kind of gliding over each other when they should just tip when you move. So that adds another little bit of instability that makes it harder to get this thing to stabilize. Number 2, you've got muscle imbalance. The muscles along your spine in your neck are stronger on the right. So kind of like guy wires on a tower, a radio tower holding it up. Yours are stronger on the right, so it keeps pulling it out of place, which is frustrating because I will adjust you. You'll go home and use those muscles for walking, bending, lifting, posture, breathing. You use them all the time. And the strong muscles pull it back out of place again. Quite frustrating. And we don't want to play that game forever. So we're going to teach you some exercises that we call maneuvers that will help rebalance those muscles. These maneuvers are very simple, very effective at isolating and rebalancing the muscles. So this is your homework. The better you do these, the less you need us. So we want you to do them twice a day. They take about 5 minutes to go through, and they're pretty simple to do, pretty self-explanatory. But we're going to send you an email with a link to a video that shows you exactly how to do them as well. So that's one piece. The third thing that adds instability to your spine is problems with the foundation of your spine, which is your feet. Your whole skeleton rests on your feet. And your feet, instead of resting like this, are tipping to the outside. That's called pronation. And there's a couple things you can do about this. One, you can do an exercise that's on the bottom of your sheet. It's called the knuckler, that helps tone the muscles that hold those arches together. Secondly, your score is well over 80, which is the point at which you should consider putting orthotics in your shoes. Have you done orthotics in your shoes before? All right, they're inserts that lift that arch up. And when you do that, you want to make sure you get a flexible system, not a rigid plastic system. So there's two kinds that I've found that work. One is the Dr. Scholl's scanner system. They have it at Meijer and Walmart in the pharmacy department. They do a scan of your foot kind of like this, and they tell you what number of their system to use. That's a $50 system. The second option is more customized, where we send this in digitally and they build an orthotic exactly for your foot. Those are $350. Your insurance may or may not help with that. You can call them and ask that, or Tammy can help you figure that out too. So that's the structural component. Misalignments, irritating nerves, driving inflammation. We reduce the misalignments by adjusting you. You help stabilize that correction and hold that correction by doing your maneuvers and working on the stability of the arches in your feet. Any questions about the structural component? Okay, second we're going to talk about body chemistry. You did the Zytoscan, which is that blue gizmo that you put your hand on. That looks at 171 different things that your body's doing chemically. You had 40 of those out of balance. That's not a horrible score, but it does mean that you're using up nutritional resources faster than you're putting them back in. So that can be a dietary issue, or it can be an absorption issue. Let's talk about your diet just a little bit. How do you do with fruits and vegetables? We should be getting 5 fruits and vegetables a day. How do you do with that? Okay, so that's something you could work on a little bit and bump that up. Number 2, what multivitamin are you taking? Okay, so there's a problem there. There are synthetic vitamins and whole food vitamins. Synthetic vitamins like One A Day, Centrum, Theragram, things like that. All the vitamins are there, but they're not in an absorbable presentation. So when you finish that bottle, because you're getting something out of it, so finish it up. But when you finish it, switch to a whole food vitamin or a natural vitamin. You'll get one of those either by going to a health food store or get it here, because then you'll get one that your body's going to absorb. Once you make those changes for 30 days, we can do another scan and we'll find out what it's doing to these scores. And we do these free for our patients, so all you got to do is remind us and we'll get that scan done so we can track how that's coming along. We want to make sure you have the right resources nutritionally as you heal and rebuild stability in your spine. All right, any questions so far? All right, the next piece that we have, and the last piece before we adjust you again, is kind of a review of everything we just talked about. So there's 3 pages. The first page is the exam we did. There were 11 factors we looked at, a possible 110 points. You got a 67, which is a low B in my grading scale. That's better than most people do when they first come in. Page 2 is the practical piece. This is things you can do to evaluate and work on our 3 goals that we work on here at Delta Chiropractic. One is get you feeling better as quick as possible. Number 2, build stability in your spine. And number 3, equip you to deal with the stuff that life throws at us, whether it's stress, viruses, traumas, things like that. We want to make sure you're ready to deal with the things that life throws at us. So this is fairly comprehensive, and it talks about a number of factors. Number 1 is your adjustment schedule. We're going to see you frequently at first, 3 times a week for 2 weeks, twice a week for 4 weeks, once a week for 6 weeks, and then we kind of reevaluate what we're doing. You may go through that faster than what I wrote here. It depends on your activities, stress levels, how well you do with your maneuvers, but this is at least an educated evaluation of what it takes to get you from where you are to where you want to be. Number 2 is your maneuvers. You're going to get those today. You're also going to get a link to that video that shows how to do them, and we'll talk some more about that. Number 3, we talked about being careful with twisting and with looking down, correct? How's that going? Right, there's some things to watch for there so that you're not undoing what we're fixing in your adjustments. Next is your feet. We talked about doing that exercise, the knuckler exercise, to help tone the muscles in those arches. And then the orthotic piece will help you implement that as we go forward as well. Stress is a big factor in your life. You gave yourself a high stress score in your initial paperwork. So we encourage 30 minutes of massage once a week, and that helps with the stress management. It also helps with the muscular component of what we're dealing with here. So Ruth does a great job with massage here in her office. You can certainly do that other places if you've got a place you're comfortable with. but stress massage will help with what we're dealing with here, help us support what we're trying to correct in your spine. The next piece was nutrition, and we talked about the bioavailable or whole food multivitamin. We're going to get that implemented soon. And then we'll do a follow-up Zytoscan down the road about a month or so. Let's see, the last piece is, again, about 3 months down the road, we do a reevaluation. Each visit, I'll evaluate how you're coming along using two main tests. One is the ProAdjuster scan, second is your symptoms. As those settle down and behave better and become what we want them to be, we will give very specific recommendations about your next visit, each visit. But at least at this point we know that we're aiming at this adjustment schedule, and they'll help you set that up at the desk. The last page is fees and finances. I don't like financial surprises myself, so I try to avoid those for my patients. So everything we talked about is on here, and as you implement pieces of this, we'll help you know ahead of time what out-of-pocket costs to expect. If you decide to implement things today and want to prepay, there's a way to save 20% on that, so let us know if you want to take advantage of that. Otherwise, you can certainly pay as you go, but there are some savings available if you commit to prepaying. Any questions about that? This will be in your packet when you leave, along with copies of your reports. And as this all percolates through your brain and you think through it all, if questions come up, they're certainly welcome at any time. You're going to get copies of your reports and a copy of our book when you leave today. The book talks about the 6 aspects of health that you can work on to maximize your health. So that'll be in your packet as well as a gift from us. Any questions? All right, let's get to the adjusting room and we'll give you your second adjustment.